From unceded and unsurrendered Algonquin territory, Tansei, and welcome to the First Nations Health Managers Association virtual town hall, giving you the credible, reliable information that you need on COVID-19. We certainly appreciate and love all of you for letting us into your homes, welcoming us to your territories, and using this format to get your questions answered on COVID-19. If you have a question, and I know a lot of you folks do, please send that question to fnhma at ihtoday.ca. Speaking of ihtoday.ca, a big thank you to the Nation Talk team. Of course, that's Dawn, Stella, Chris, and merci beaucoup to Pascal Belanger for ensuring that we get this out to you in both English and French. So settle in, folks, because the next hour is ours while we share our knowledge on COVID-19 and resources that are applicable to anybody working with Indigenous nations across Turtle Island. We have a great panel, just like we do every week at the FNHMA town halls. We are welcoming back Dr. Valerie Gideon, joining us from Indigenous Services Canada. And then, hey, everybody who's living off reserve, we also have with us Jocelyn. Jocelyn from the National Association of Friendship Centers is going to give us all the information we need for off reserve as well. So it's a great and humble privilege to be working shoulder to shoulder from a distance virtually with both Jocelyn and Valerie. So let's roll up our sleeves. I know you have your bannock and bologna sandwich, which I'm craving so much, ready to settle in for this hour-long dialogue. So enough of my voice. I really want to welcome Dr. Valerie Gideon. Welcome back, Valerie. It's so exciting to see you.
Thank you so much, Marian, for the invitation to participate. It has seemed like it's been a long time, and yet we're still here. We're still doing the COVID updates to the First Nations health managers, and that's I'm very grateful to see that and to see that these town halls have continued over all these months. We were just reminiscing in our prep about the first one being held on March the 25th of 2020. At the time, I was still working in the office. That didn't last for very much longer, and certainly did not anticipate that as of February 10th, 2021, we would still be doing these town halls. But I think it's wonderful that you've been able to sustain them. I'll start by just acknowledging, of course, that I am on unceded and absolutely beautiful Algonquin territory this afternoon. Je voudrais vous remercier, bien sûr, pour l'opportunité de vous adresser cet après-midi. Et puis, ça va me faire plaisir aussi de répondre à des questions en français si vous en avez. Et aussi, je veux bien sûr saluer tous mes collègues membres des Premières Nations de la région du Québec et ailleurs, bien sûr. I am Mi'kmaq from the Gaspé First Nation in the Quebec region, and when we were doing these town halls, I was at the First Nations Inuit Health Branch of Indigenous Services Canada. I have transitioned into the associate deputy role, but certainly still very engaged with respect to supporting our health team, but also our overall emergency management team, education team, infrastructure team, social services, child family services. Everybody is involved with respect to supporting the COVID-19 response. So I'm not a medical doctor, but I have some information to share with you with respect to the COVID-19 current situation. If you do have more medically oriented questions, we can certainly take those back and have one of our public health specialists in the department provide responses through the website or email. And as you know, Dr. Tom Wong, our Chief Medical Officer of Health, and Dr. Evan Adams, our Deputy Chief Medical Officer of Health, have been able to participate as well in town halls hosted by FNHMA over these many months. So I'll just start and reiterate a bit of the information that Dr. Wong shared yesterday at the minister's weekly press conference. The Minister Miller of our department has been doing quite regular press conferences to share the latest information with respect to COVID-19. And what we were able to report yesterday is that we are continuing to see some positive signs that the curve among First Nations on reserve, and I recognize, especially with Jocelyn from the National Association of Friendship Centers being part of this panel, that the data that we have is absolutely incomplete. But with respect to First Nations on reserve, the curve is beginning to flatten. The rate of active cases in First Nation communities has decreased by more than 50% over the past 3 weeks. And actually today was the first day in quite several months where the number of new cases was below 100. The total cumulative cases among First Nations on reserve is now at 18,431. We have 1,553 active cases. That was the number as of yesterday. As I noted, that's been a significant reduction over the last 3 weeks. 150 hospitalizations have been reported, and quite regrettably, 199 fatalities. But Canada's fatality rate is 2.5 times over the fatality rate among First Nations on reserve. With respect to sort of the cross country scenario, I won't give you all the regional details, but you can find them on our website. However, I will note that Manitoba continues to trend down at the number of active cases being below 200. Saskatchewan, however, is accounting for 1/3 of all First Nations on reserve cases, as is Alberta. BC represents 16% of cases among First Nations on reserve. There have been no new cases in the Yukon, Northwest Territories, or Nunavut that have been reported. And Nunavut has reported 1 new case in Arviat, but there is no community transmission in that community, and a total of 6 active cases overall. One of the things that I have sort of observed over the second wave in particular is that while, and I'm sure you've observed it and others have commented, is that while Ontario and Quebec in the general population have really dominated with respect to the number of cases, I think the fact that public health measures were pretty consistently in place across the hotspots in those provinces, I do think that it assisted First Nations communities to be able to maintain some more stringent public health measures, including limiting access to for non-essential purposes to their community. Unfortunately, I do think that some of the public health measures that came into place later in some of the prairie provinces, unfortunately, did not prevent some of the number of cases that we saw spread across a number of First Nations communities in those provinces. And as a result, it was more challenging for communities to then get on top of some of the community transmissions that have taken place. But very grateful to see that, as I've noted, the curve is starting to flatten, but we have to absolutely maintain that vigilance. And even if there is an allègement, as we say in French, even if there is a gradual reopening and reduction, I would say, of some of the more stringent public health measures, I think it is really important for all of us to collectively advise First Nations leadership on really what needs to be maintained at the community level. recognizing that the population is at greater risk, and also recognizing, though, that for sure there are some sustained impacts to the isolation measures, social isolation measures that we are facing. But again, I think it's the just overall reflection that where public health measures have been maintained more consistently across the country, we have seen a reduced number of cases in First Nation communities, and that's an important lesson learned. Of course, also the cases of COVID-19 variants are of concern in Canada, and data has suggested that these variants are more transmissible and pose an increased risk of outbreaks in high-risk populations and communities. And this would, of course, include congregate living settings, remote and isolated settings. And so really, again, emphasizing the point about advising leadership to maintain as much as possible some strong public health measures in communities. In terms of the vaccine, as of Monday of this week, which is the latest information that I have, over 72,000 COVID vaccine doses have been administered in 344 First Nations, Inuit, and territorial communities, which is reaching 12% of the population vaccine dose target at a rate that is 6 times that of Canada. We are absolutely seeing regions that are demonstrating incredible leadership in prioritizing First Nations, Inuit, and Métis in their vaccine rollout. For example, First Nations in Manitoba are working with the province to really make decisions with respect to how vaccines are mobilized in the north, but also in the south, and including in urban populations where we did see that an immunization clinic was opened in Winnipeg for indigenous healthcare workers, traditional healers, and knowledge keepers. And that is one wonderful example, but there are others in other provinces. At our departmental level, we are working very closely with the Public Health Agency of Canada, but also with the Canadian Armed Forces to help facilitate and support the vaccine rollout. You may have seen in the press the very strong collaboration that is taking place with Anishinaabe, Aski Nation in terms of their leadership, but also their communities. And this, you look out First Nations Health Authority, Winnebago Area Health Authority, and other partners in order to be able to support vaccine clinics across the 31 remote First Nations communities in Ontario. And it really is an incredible partnership where, the province is providing support for the vaccination clinics, including Health Human Resources, where our department operates nursing stations. We are, of course, continuing to maintain access to the essential healthcare services, but also in a position to provide surge capacity for those vaccination clinics as may be required. The provincially contracted air ambulance service and others, Orange, is offering the transportation supports for those services. The Canadian Armed Forces is offering logistics support to manage that full-scale operation. So you've got a lot of people mobilized to ensure that those vaccines will be administered as quickly as possible and as safely as possible to those populations. On a besoin vraiment de l'aide de toutes les provinces et les territoires dans le processus de la co-planification pour mobiliser les ressources et s'assurer que les vaccins rejoignent les communautés autochtones, incluant bien sûr les populations autochtones qui demeurent en milieu urbain ou hors de leur communauté. On a vu une collaboration, par exemple, à Montréal pour aller chercher vraiment rejoindre les individus qui sont plus vulnérables dans la ville de Montréal et cette collaboration-là vraiment va continuer. Et on voudrait voir bien sûr des modèles très similaires à travers le pays et vraiment c'est pour ça que je pense que le partenariat avec l'Association nationale des centres d'amitié autochtones qui va parler à la suite de mes remarques sont vraiment très importantes pour essayer de guider les provinces et les territoires dans leurs efforts. In addition, maybe just before I turn from COVID to other priorities, I would just like to sort of note that in terms of the number of vaccine clinics that have been hosted to date in First Nations communities, Inuit and territories, there has been the largest number of clinics in British Columbia, as well as that is also the largest number of individuals that have received vaccine doses. In terms of the number of clinics, that is then followed by Saskatchewan and then Manitoba. However, Ontario is very rapidly also ramping up. There's also been a number of clinics in the Northwest Territories, the Yukon and Nunavik, and also Nunavut. In terms of the proportion of the population that has, or the number of individuals that have been immunized, in addition to BC, we have seen very strong numbers out of the Northwest Territories, la Province du Québec, the Yukon, and Nunavut. So in terms of other updates, maybe what I could mention is that, as many of you would have seen also in the media, the department with Health Canada and Crown Indigenous Relations and Northern Affairs, hosted by those three ministers, held a national virtual dialogue on January 27th and 28th, specific to anti-Indigenous racism. It was a follow-up to the October 16th, the national meeting in memory of Joyce Echaquan, and the calls to action against racism that came from her absolutely tragic and horrifying experience, including her passing. At the October 16th meeting, there was really a sharing of lived experiences of First Nations, Inuit, and Métis as patients, as family members, but also as health professionals. We also heard from key experts like Mary Ellen Turple-Lafont and also Senator Yvonne Boyer, as well as the National Chief of the Assembly of First Nations, Inuit Tepirit Kanatami President, and the National Spokesperson of the Métis National Council. On the second dialogue of January 27th and 28th, that meeting was really focused on hearing from organizational representatives on their recommendations, but also their actions, their commitment to action. Understanding, of course, that the Canadian health system is very complex and there is a shared jurisdiction model that also leads to, that can sort of facilitate sort of a bit of paralysis at times in terms of moving forward on some comprehensive action plans. And so we wanted to sort of hear from those organizations that play a key role, whether it's a regulatory role, whether it's an education role, whether it's a funding role, whether it's actually delivering healthcare services, really hear from them in terms of what can they do and what do they think others should do with respect to addressing this very, very significant issue, and an issue that we have seen really have an impact also during COVID, where people were stigmatized or where they were even denied access to services or received such poor care that it impacted their health and their well-being in a very significant way, including premature mortality. And so, from this dialogue, we will be, of course, producing a report within the next few weeks. And we have committed to hosting another dialogue in the spring, which will be more focused on some very specific issues that arose from those last two meetings. We are also, Minister Miller, announced the launch of the co-development of distinctions-based Indigenous health legislation. This was a commitment that had been made in the last two speeches from the throne, and funding had been committed through the fall economic statement of about 15 million over 2 years to support that process. He was also able to announce specific funding to the Atikamekw Nation, du financement pour la nation Atikamekw et la communauté de Manawan, la communauté de Joyce Echaquan, pour continuer leurs efforts vers la revendication de toutes les actions qu'ils recommandent pour éliminer le racisme systémique, non seulement à l'hôpital de Joliette ou dans la région du Québec, mais aussi à travers le pays. So we were able to commit some funds to their work, and also just to ensure the commitment to preventing her legacy from ever being forgotten, and to ensure that we continue to build momentum across the country with respect to addressing this issue. We are also going to partner with the National Collaborating Centre on Indigenous Health for them to host materials that have been provided, written submissions in the context of these national dialogues, but also other very helpful materials to support cultural safety and humility-wise practices and actions. And so we're very pleased with that partnership with Dr. Margot Greenwood. So, I mean, I think in terms of next steps, there will be more that will be coming forward in terms of information subsequent also to the report. And there will be also a list of regional dialogues, theme-based dialogues that organizations will be hosting, including the Canadian Indigenous Nurses Association, the First Nations Health Managers Association, I believe, is also doing some work in this area with some of the mainstream health organizations. But we expect that more will be occurring as well, and we will be in a position to be able to support that. Et avec ça, je pense que je vais terminer mes remarques, mais ça va me faire plaisir aussi de répondre à vos questions. I'll be happy to answer any questions and point you to any other resource materials. I know the info point service of FNHMA has been extremely helpful to be able to help individuals that are navigating through a lot of different websites, a lot of different organizations, to try to pinpoint the information that is most helpful for them. And we did issue a vaccine specific communications toolkit that I know is assisting some communities in terms of running their own campaigns. You know, I do think that vaccine hesitancy, a lot of people have talked about it. I've seen, you know, very strong uptake and heard reports and seen reports of very strong uptake in communities, but there is variability, and I think making sure that we're proactively supporting trusted sources of information to counter some of the misinformation that is unfortunately being perpetuated through social media in particular. Il faut vraiment qu'on s'y mette tous pour que les gens puissent prendre leur propre décision, leur décision personnelle, mais une décision qui va être informée sur la bonne information. And Marian, I will turn it back over to you. Merci beaucoup. Well, Alan.
Thank you so much, Dr. Gideon. We so value that you have taken the time to join us today to inform all of the listeners and viewers that we have on all the different Facebook pages, on the 150 Indigenous radio stations who broadcast this live. And as an Associate Deputy Minister, Val, we know your time is precious, but thank you for making time for us to share this very valued information. And I have to say, look at this panel, from one First Nations woman to another, and now over to another one. I have to say, what a great time to show Indigenous boss babe. How about that for a coffee mug, you guys? And if you don't have this yet, She Native in Saskatoon by Indigenous, and look at the Indigenous boss babes on this panel. Now, I do want to remind you that if you have a question for Dr. Gideon or for Jocelyn, it's still time to get it in to FNHMA at ihtoday.ca. All right, we are coming back to those questions after we welcome back Jocelyn. Jocelyn, thanks for taking the time out of your day as well to share what the National Association of Friendship Centers are doing for our brothers and sisters living in cities across Turtle Island. Welcome, Jocelyn.
Thank you so much, Marian. So, Wache Miswe, Shwebenish, Nishnakasun, Muskri, Natosjin. My name is Jocelyn Formsma. I'm originally from Northern Ontario, member of Moose Cree First Nation, and have lived in Ottawa for a number of years, and currently the executive director of the National Association of Friendship Centers. And I think maybe I'll just kind of start a little bit with, you know, sort of if we could take take it back to last year as to what our experience was, and until today, in our role, and hopefully future role in vaccine rollout. So yeah, I remember I was at a conference on housing, and and was like, oh, there's not that many cases in Ottawa, or there wasn't at the time, and I think less than 50 or something like that. And then the next day, the pandemic was declared by the World Health Organization, and that was a Thursday or Friday or something like that. So we had a lot of decisions to make. Monday morning, by Monday morning, my staff was all working remotely, and we were supporting them to do so. And we immediately sent out a note to our network of over 100 local friendship centers and provincial territorial associations, saying, we don't know what's coming, we don't know what's going to happen, but we're here for you as a national body, as your association, and we're going to get through this together. So what we saw in those early days, with so much uncertainty, so much unknown about the virus and spread and all these kinds of things, that friendship centers were opening their doors even wider, sometimes only figuratively. So some centers had to close physically their doors, but we're still providing services. A lot of food security, food delivery. We actually have hired more folks in this time than we've had to let go, which I think is really important. But that's just like to meet the demand of the community. So also helping people get to their appointments, pivoting important programs to be provided online, and then also purchasing items such as tablets and phones and laptops so that children could participate, young people, the elderly. They set up phone trees so that to help reduce isolation amongst our Indigenous seniors. And I am still learning every single day more and more about what friendship centers are doing to respond in this time. And it's been quite heroic and quite incredible. I just feel blessed to work for such a network of strong, community-minded people, right? It's what wakes me up every single day. It's just knowing they're out there working so hard on behalf of our communities. Early on, I think we had a big challenge with kind of getting the different levels of government to talk to each other. So definitely federal was responding immediately on reserve in the north, which is totally understandable. I mean, I should preface by saying anything that we're talking about that's critical about response, um, and anything in our advocacy is not to be interpreted as at the expense of what's happening on reserve in the north and for First Nations and Métis Inuit governments, right? We are those are our kin, that's our family, those are our friends, and we are so happy to see any efforts that are happening in those communities. And we feel like we can bring a voice for the urban people, that doesn't have to be at the expense of anybody, right? It shouldn't be one or the other. So I think I always have to put that forward, because sometimes it's misinterpreted that when I'm talking about the response for urban, that it's interpreted as, well, what about on reserve, or where's the need greatest? And we're just trying to say, like, we are trying to add a voice to this conversation, to make sure we're not leaving anybody behind. And that seems to be something that really resonates. Um, so our friendship centers are still doing what they're doing, still supporting people. Food boxes, hundreds of thousands of food boxes are going out every single week. Depending on the lockdown situation in the provinces or in the specific communities, some are still able to gather, and they do safely, according to the local health authorities. Some are just not able to at all, and everything has to be remote. So they're definitely responding in any way that they can. A lot of friendship centers are hosting shelters and have been raising alarm bells since the summer and the fall to make sure that we don't forget about our friends and our family that are living on the street and don't have shelter. And it's been really hard. I think about those folks, especially the ones that have been freezing to death, and it's just one of those things that just makes you feel like you're not doing enough, and certainly we probably could be doing more collectively to make sure that um So that's kind of like the COVID response overall. We were fortunate to get funds through the Indigenous Community Support Fund, which has been life-saving, literally life-saving for both like the friendship centers and the people that they're serving. We really appreciate that support, and definitely want that to continue. We're certainly worried about fiscal year end and what's going to happen for folks who, show up on the doors after fiscal year end ends, and wanting to make sure that we're part of that build back better, not just for next fiscal year, but in the years to come as our urban Indigenous communities are rebuilding and finding their place within those communities. I'll just talk a little bit about what we're doing now on vaccine response. So I need to be upfront. Friendship centers are not decision makers. We are not involved at all in rollouts, except for how we're being engaged by the provinces. I think it's really important that when it comes to urban Indigenous people and communities, that the federal government has been supportive to the extent that they can be, but this largely falls within provincial jurisdiction. And so I know people have been critical about federal government response, including us in the urban settings. But we're like actively working with them to try to figure out how do we provide a national supportive role, but then we really push provinces and territories and the decision makers on the vaccine to ensure that urban Indigenous people are full parts of their strategies going forward. So we've had Dr. Adams, Dr. Wong, even Minister Miller bringing up in different different forums that they've been involved in, and we're trying to inform our champions and people who are in these decision making groups and giving them information. So I think we were doing a little bit of ruckus raising. We kept we kept getting these invitations to these meetings and saying, hey, what about urban? What about urban? And so we actually were able to establish an urban working group on vaccine rollout. And so we've been talking to not just friendship centers, but other urban Indigenous organizations, urban Inuit organizations, Métis Nation, different Métis Nation representatives have been coming to the table, and just providing that forum so at least the voices can be heard. And what we've been trying to do with the group is collect those voices from that urban working group, document what is happening on the ground, and developing strategies that then we can put into the hands of people so that they know exactly what they can do. Because a lot of times people feel kind of stuck and like, well, I'm not really sure what to do or how to address this, or I don't have anything to look at as an example. So we've kind of taken those reasons away from them. We've developed an issues and challenges barriers document that outlines just considerations that we know are really important. So like ensuring there's strategies for folks who are homeless or unsheltered, children and young people who are part of CFS, Child Family Services, Indigenous elders, seniors, people with disabilities and special needs, considering transportation. So I think that's a huge thing, even within major metropolitan areas, making sure that if you have a vaccine clinic that people can actually get to it, and engaging with local organizations to facilitate transportation. If they don't know about it, they can't help. So making sure that we're doing that outreach, not just within the health field, but other service providers that can provide that supportive initiative. Specific outreach strategies for each specific group. So for urban Inuit, for urban Métis, for urban First Nations, Two-Spirit, LGBTQIA, making sure that we're not leaving anybody out. And then how these organizations might be able to help with tracking vaccine uptake, especially with the second dose. And then trying to encourage unique and innovative strategies, such as like rolling out mobile clinics to be able to get to sites where people are, as opposed to making them travel. And then same thing, like, trying to tackle the misinformation. So those are some of the challenges that we've identified, and that we're trying to collect sample strategies of how organizations, communities, or regions have overcome some of those barriers. And we just want to keep tracking those things modeling so that other people have a model to look at. We've also developed a model sheet. So in terms of what it can look like, not every urban Indigenous organization is going to be able to provide a full vaccine clinic. Although we've sort of polled our network, and we know that at least half of the friendship centers, so between just over 50 to about 50 to 60 friendship centers, are ready to take on a vaccine clinic if they are able to get the vaccine commitment from their respective province. And I know that in Northern Alberta, for example, in Nova Scotia, they're getting close to looking at those kinds of things, but we really, really want that first example so that we can show that as an example that can be replicated across the country. And we want to show the success of working with urban Indigenous organizations and communities so that we're not leaving our people behind. So we talked about utilizing existing urban Indigenous health clinics. There's a whole network of health clinics that are run by and for Indigenous people. They should be the first place that we go to look at, because they're already providing vaccines. They're already providing those healthcare services, right? If there's a provincial municipal public health services carrying out a vaccine clinic, consider doing a special clinic in an Indigenous space. A hall of a friendship center or another urban Indigenous organization. A lot of friendship centers have parking lots that are available if they want to do a mobile clinic, for example. If you cannot do that, provincial municipal public health services can provide or support the mobile vaccination teams to work with Indigenous outreach teams. So if you're going to be in a location, notify the local urban Indigenous organizations so that they can let their community members know where to go, and they can help facilitate access to those sites. Reducing barriers to provincial vaccine centers and locations. So sometimes they have these mass locations. Transportation is going to be an issue, but then it also can be kind of like intimidating when you go there and you don't see anybody that looks like you, right? So having support workers present at these locations to make people feel comfortable, to make sure their questions are answered, and that they are feeling comfortable about what they're about to do. We were talking about even examples of even a space to have some medicines if somebody wants to smudge, or maybe offer tobacco, or just friendly faces that help facilitate cultural safety within those existing vaccine locations. There's even opportunities for Indigenous organizations to offer the vaccine, not just for Indigenous populations, but for everybody, right? And maybe is a safer space than for other marginalized community members, such as Black community members, communities of color. This could be an example where, it's not a mainstream and might be a little bit safer in those circumstances. And then Indigenous community healthcare providers host or partner vaccine sites and clinics in urban settings. So we do have a lot of urban Indigenous organizations that do have the full capacity to offer these clinics. They already offer annual flu clinics. They already offer diabetes clinics and workshops. They're already providing these services, and they know how to do it, and they have the connections to make it happen. The key piece is getting the vaccine, the provinces to agree to get some of the vaccine into those clinics. And so that's where we're trying to really, really push and encourage those kinds of partnerships so that we can make it happen. There's a lot of question, and certainly we've also developed an action plan that has some key areas that we all want to be working on. So I'm not going to go through it all, but just like areas around communication, awareness and advocacy, engagement, and readiness and capacity for Indigenous organizations. So we've done a lot of the work. We're trying to take a lot of the mystery out of this about the partnerships. We're trying to take a lot of the next steps mystery out of it, just saying, here, we've kind of done it for you to help facilitate those partnerships happening. Because ultimately the decision, as we said, is going to happen at the provincial level. It's going to happen at the regional level. So we've had a lot of questions around, okay, well, why urban Indigenous? Like, we're already immunizing on reserve. We're already immunizing, here and there. And yes, absolutely, we are so happy to see that. But Indigenous people travel. We go back and forth from our communities all the time. And if we think that our community is now safe to travel to because it's been immunized, then without having that full knowledge, then we don't want to put our community members at risk, our family members at risk. the same comorbidities that exist on reserve exist in the urban centers. So if we think about the people who I call the pushed outs, so people who had to leave their community due to education, healthcare, lack of housing, lack of long-term care, they're not necessarily in the city because they want to be, they're there because the lack of resources at home. So the same, for Indigenous elders who might not be in some of the like big long-term care facilities, but still may be within that risk group. We want to, for a majority of First Nations, Métis, Inuit, Two-Spirit, we are majority in the cities. We're in towns, we're in cities across the country. So majority of us are urban. And so, if that's the population that we're trying to reach, we really need to make sure that that we have those urban strategies. We also really want to make sure that our community members know about these opportunities. So that's another benefit that Friendship Centers and other urban Indigenous community organizations provide, is that we have our membership lists. We have people who are paying attention to our Facebook pages and communication. So when we send it out, it's going to have a lot greater impact in our communities than just the local public health authority. There's an element of trust and the cultural safety that I mentioned that we can help provide and make sure that people aren't just doing it because like that they feel safe in reaching out and accessing that. And the outreach, we know where our people are in the cities, and so it's not going to be successful if you just put up a poster or put up a post. You actually need our organizations to do that active outreach to our community members and then facilitate their participation in a way that's safe. So yeah, I think again, just to wrap up, I think the key pieces are really putting pressure on the provinces to ensure that all of their vaccine action plans include strategies to reach urban Indigenous communities and community members, and really mobilizing around what we can do to kind of set it up. It's like the whole, if we build it, we will, they will come. We're hoping that if we take away the mystery, we take away the barriers, we provide information, then it facilitates provinces being able to say yes a lot easier. So yeah, that's it from me. I'm happy to take any questions, but thank you so much for having me and being able to share these perspectives.
Well, thank you so much, Jocelyn. I have heard you at the tables taking on the provinces, and I thank you. As somebody who lives in Ottawa, we all want to know, when are we getting our vaccines as well for those who are off reserve? And there are people asking, my reserve is next in the queue to be vaccinated. Do I go home and get a vaccine there in the community and risk putting our Indigenous elders at, there's just so many questions about on and off reserve, and we do not want to put anybody at risk. That's one thing everyone agrees on, is let's not be going out and about, and let's continue to push the provinces to not forget about all of our kin, as you said, Jocelyn, that live in the cities as well, and not always by choice. A number of circumstances why people are not on reserve. I do want to say a quick thank you to some of the viewers and listeners who are watching this town hall. Randall from Dauphin River First Nation, thank you for getting your information here where it's a safe place to get information. And Tammy also says, hey, Jocelyn, great work that Friendship Centers are doing. So for those tireless days that we all have, especially in the last year, those are the reasons why we get out of bed, and it's so nice. And I had to share with you that. Thank you for your efforts and your advocacy. It's so appreciated. And I see that there are a lot of questions, so let me just jump in there now. So this one I'm actually going to give to Dr. Gideon Val. There's a question here specifically on Jordan's Principal Initiative. And the question is, how has, or if it has, the Jordan's Principal Initiative been modified in terms of COVID-19 supports, given the lengthy application process in some instances, with some of the ISK staff working from home, etc. Have there been modifications to accommodate the pandemic lens, Dr. Gideon?
That's an interesting question. I mean, we certainly have continued to see a significant volume, and actually our compliance with the Canadian Human Rights Tribunal order timeframes has been improving. We did certainly the call center and all of the processing of requests continued over the course of the pandemic. And I think they're all equipped to work from home. They all have access to the case management system to be able to move forward. But that being said, we have absolutely recognized that access to professionals, to, for referrals, for example, assessments of children's needs have been postponed in many cases because a lot of, especially assessments that required physical presence, for example. So we have bridged services for children up until the time where they might be able to get an assessment where we would have a fuller understanding of what their service requirements are. We've certainly not requested or required the same degree of sort of written documentation that we would. So, we will accept sort of verbal recommendations or email recommendations or things that, typically you would have sort of the letter on letterhead and so forth. Now, a lot of professionals have been able to also adapt their practices since the first wave, right? And there's been a lot more access to virtual services now than there was in the first wave. So there's more sort of, and dental offices have reopened, and there's been some movement on that front too. But for sure, initially, that was absolutely part of the process. And non-insured health benefits, as an example, also lifted a lot of the sort of pre-approval requirements for medications, for example, things of that nature, knowing that, people couldn't access their family physician, for months in many cases. So we've made those types of adjustments. The other aspect, though, is that Jordan's Principal has also stepped in, particularly before the Community Support Fund came into place, as well as the funding specific for First Nation schools. Before that, Jordan's Principal was really filling gaps in terms of access to supports for families, education supports, food allowances, all sorts of different supports for families. We've not, we've tried to track COVID-specific Jordan's Principal requests as much as we can, but sometimes they're intermixed with other needs of the child as well. So it's not a perfect model, but we do report specifically on COVID-related requests of Jordan's Principal, and that information is available.
Thank you very much, Valerie. I almost forgot to unmute myself. How many shows have we been doing? And I think we can all agree that that is the new "you are on mute" message of 2020 and now 2021. I'm going to take it over to you, Jocelyn. In terms of planning for large-scale vaccine rollouts in the cities, are you aware of any friendship centers that are participating or hosting vaccine clinics at all? And can you share that with us if you know?
So right now, I'm not aware of any vaccine clinic that's happened, and I'm only aware of discussions happening right now. So I think we're pretty close in some regions, but in others, they're like the conversations haven't even started. So, if there is anybody listening from a provincial, territorial government, if and most of them do have somebody from the Friendship Centers involved in their advisory or action groups, but we're also hearing there's some frustration about, all we can do is provide advice, and sometimes that advice isn't followed. So I mean, I think that's been a common theme. So again, we just want to encourage not just the conversations to happen, but to actually see the actions on the ground. And I'm hoping in another 2 or 3 weeks, I can report back to say some that are occurring or that are planned to occur. There's been a situation in Toronto where there's very high Indigenous population, where there is a group of Indigenous organizations, including physicians, who have set up these clinics, and there has been some challenge in sort of the difference between the broad direction and then what people are being told on the ground, where there's a situation where they had a clinic set ready to go and at the last minute had to cancel it because the hospital that they had the agreement with said, well, the province told us that we can't give these vaccines to you because we're limited right now with how many we have. Those community members, which again kind of goes to the trust piece, it goes to the safety piece. But then when we spoke to some of the folks who are part of the decision-making bodies, they're saying, well, no, that shouldn't have happened. So we just want to make sure, like, the messages are clear and people know what's happening. And again, that goes back to ensuring that the right people are at the tables, and that we're being very clear in our communications and it's getting to the right people.
Thanks, Jocelyn. Stay with me because Dr. Gideon had talked a little bit at the beginning of the hour about the anti-Indigenous racism in the healthcare setting meetings that all three of us took part at. And Jocelyn, I'm curious about some of the reaction or some of the planning that you are doing as the NAFC in responding to this. And I did hear about safe spaces. Can you tell me a little bit about that? And I don't want to steal Dr. Alika LaFontaine's thunder, who will be on the town hall next week talking about it, but I know you're engaged. Tell us about that.
Yeah, I'm so glad. That was one of the points that I wanted to bring up, and I kept forgetting the last two times. So, so when the first meeting occurred, we had felt. I mean, it like it happened the way it happened, but we felt that there wasn't enough urban specific content with the anti-racism in healthcare, which is slightly different, I think, than something that would be organized or developed and implemented by First Nations, Métis, or Inuit governments. So we did our own, and we talked about the different ways that friendship centers are involved in healthcare. So in some instances actually providing healthcare directly. So there's healthcare clinics running out of friendship centers. And then there's also friendship centers that have really robust transportation. We have some friendship centers that own hotels or hostels. So with agreements from Inuit governments or First Nations governments, that when their members are traveling to the city or to towns to get medical appointments, that they're actually staying at an Indigenous run residence, so that those are some of the small things that we can do to help reduce racism, right? By having our own people provide the service. I remember getting a call. This was the day after Joyce had passed away, and I got a call from the executive director of the Friendship Center in Lanaudière in Joliet, which is where it happened. And she said, we've got a small news report right now. We only have one, it's in French, but we had a community member pass away last night, and these are the things that were being said to her as she was passing away. She said, I even saw it on Facebook because we're friends on Facebook, and I was calling the police saying, I think I'm watching somebody die right now. And so the way that the Lanaudière Friendship Center had responded in those early days, supporting the family, organizing the vigil, and receiving the calls from other people who were wanting somebody to go with them to their appointments in those days after in that same hospital, right? She was feeling very overwhelmed. She was feeling like, there was something else we could have done and we weren't able to do that. We didn't know, we should have been there. There was a lot of that. And at the time, I was worried that the case would kind of fly under the radar. Largely because it was, the early news reports were in French, English Canada. Quite honestly, sometimes just like if it's all in French, we don't read, we don't try. And then that afternoon, the story hit and it was everywhere. And so we were grateful in the sense that this was not a death that will go unnoticed, and that no action would come from it. And the bravery that Joyce had in that time, I think is a driver for us all to need to do better. So our way of doing that was talking about what we already are doing, talk about what we think needs to be done, especially within the urban space, and provide recommendations. So a path forward that we think will help reduce racism in healthcare. We think that as much as we want to have our own people developing our own systems, which is a dream, and it's something that I believe will be realized. We will always need people operating within mainstream systems, because our people are always going to be involved in some respect. We need to do the ongoing education, but I think as a harm reduction model, we need to have our own people having their eyes and ears on things and being there as a support for folks who are accessing healthcare in the urban settings. And another way that we think that we can help is through the Safe Spaces networks. So this was something that I had talked to Dr. LaFontaine early on, before any of this. And when the news hit, we were messaging each other, texting each other saying, now is the time that we bring this out and we roll it out nationally. So there are mechanisms for people to complain, either through the hospitals or through professional associations, but people don't always feel empowered to utilize those systems. And sometimes, especially in some of the smaller urban spaces, like, towns, there is a real fear of retribution, like, oh, you complained about me, but, I'm not going anywhere kind of thing. So Safe Spaces is an online format where people can go to the website. You can put in your complaint, and by working through, right now we're piloting through the BC Association of Friendship Centers, and they're facilitating conversations to get that input. And then we get systemic level information that then we can put some real recommendations forward from real life experiences.
Thanks, Jocelyn. I really appreciate giving your take. We're going to have Dr. LaFontaine come next week, joined by Pamela from ISC as well. So I know there's a number of questions in the inbox that are very specific to vaccines, to hesitancy, and we're not going to forget your questions, folks. If you have more, keep sending them in to fnhma@ihtoday.ca, and we'll ask those appropriate healthcare providers those very detailed questions about vaccines and, of course, COVID-19 itself. Dr. Gideon, I'm going to go to you for the very last question. And that question is surrounding supports that Indigenous Services Canada is offering around COVID-19, and, hearing about all the great things organizations are doing. What happens March 31? Do we continue doing those efforts? Some nations who aren't in flexible agreements, and what does that look like in terms of planning COVID responses for April?
Yeah, so we continue to have access to COVID public health funding after March 31st. So people should not be, concerned about that. If your funding agreement is not a multi-year agreement that enables you flexibility, and you happen to have funding to carry over, just contact the regional office as soon as you can to sort of identify what it is that you will require as of April 1st, so that they can proactively work with you with respect to funding for your next fiscal year agreement. And I would just say, that's included health infrastructure, a temporary health infrastructure. So far, we've funded 940 health infrastructure needs. Our PPE shipments are at 1,645. We've mobilized 326 point of care tests across the country, and it's a big jump. Even last week it was at 270, right? Like, so there's a lot of work that is happening, lots of surge capacity, nurses and paramedics, over 332 nurses and 100 paramedics have been mobilized. And that's not going to stop on March the 31st unless the COVID stops. I would love COVID to stop on March the 31st, but I'm unfortunately not all that optimistic. And I think the shifting of the focus towards the vaccine administration and what is required for vaccines, and thinking about surge health human resources, there is a shortage or less vaccine at the moment, but that is not going to be the case in the spring. And so we have to plan for mass clinics. And I would just advise folks to think about extra personnel, extra immunizers, so that you're not disrupting your existing public health and healthcare services that at that point in time may be managing an outbreak, may be managing a crisis in the community, and also dealing with some of the consequences of COVID, such as mental health impacts, for example. So really think about surge immunizers.
Well, thank you so much. I want to just heartfully thank you for your tireless efforts. You are both warrior women who I love and respect, and I can't imagine how exhausted you both are. And that's not to say that all of our Indigenous health workers, managers who are listening and watching, we know you're exhausted. Feel the love that surrounds you and supports you, and we hold you up. Thank you again so much for being with the FNHMA COVID-19 Town Hall. I want to say thanks to Micmac Maliseed Native News, who also partners with us in getting you this information. The Wolf 95.7 Nation News, Element FM in both Toronto and Ottawa, NCIFM. Hey, Davey, Jordan, Garth, thanks for having me every Thursday morning to talk about what's upcoming on these Thursday town halls. Eagle Feather News, Alberta Native News, CJWE, CFWE, CKLB, Co-op Radio, APTN. Thank you. You are getting us the reach that we need. Of course, Anishinaabeg Nation. And you can also hear these broadcasts again later on your local radio stations. So please check out your radio station that you're listening to now for the rebroadcast times and dates. With that, I look forward to welcoming you back to the next FNHMA Town Hall, where we will have back Pamela from Indigenous Services Canada to nerd out on vaccines and those discussions, and Dr. Alika Lafontaine. Until next week, you know the drill. Stay safe, be kind, and continue to show that love and appreciation for your healthcare provider. See you next Thursday. Hi, hi.